Hey guys, it's Dr. Greg Grobemeyer with Practice Booster. I wanted to talk to you real briefly about the recent changes that happened at D4355. There's a lot of implications about these changes, and I want to discuss that with you. So just looking at the changes that came out of the Code Maintenance Committee, they did alter both the nomenclature and got rid of the descriptor that was associated with D4355. Now, this has a lot of implications about how this code can be used now that is different from how it's been used in the past. Now, when this information was first released, we worked with ADA about the interpretation and got their approval and felt like we had a great write-up. But the print version that we put out mid-year last year, that's when it went to press, has now been revised. So as of January of this year, ADA has come out with some new interpretation that makes a lot of the information that is in the print version of Dental Coding with Confidence for 2023 incorrect. So if you've got the digital version or if you've got the code advisor on practicebooster.com, this will be updated automatically. However, if you have the print version of the book, know that there's some incorrect information associated with this code. So let's take a look at that. Here's a QR code. I'd love for you to go out and actually read ADA's version 2 as of January 2023 about what the interpretation of this code should be. So basically, it's the same situation. If you've got a patient that comes in, you've got enough plaque and calculus that it's inhibiting a periodontal evaluation, you need to do a D4355. That allows you to do a better evaluation. So in order to establish the need for that, however, first, the doctor has to lay eyes on the patient. So that needs to be noted in the chart that the doctor did a cursory exam to establish the need for D4355. That can also be done in the form of doing a D0191. That's an assessment of a patient if you want to use a code. You can even do a limited exam, a D0140, and you charge for it if you'd like to. That does mess with patient's limitation factors, so that's at your discretion. So, and now ideally in most cases, what you're going to do is do the D4355 that day, wait for a period of healing, then get them back, and at that time do a D0180. That's the comprehensive periodontal evaluation, 6-point probing, charting, bleeding points, pocket depths, the whole bit. And so if you're doing that, those services do the D0180 as long as it fits the descriptor of that code. So, but there are now access to care issues that the ADA wanted to address. So if you've got a situation where you have a patient who's having to come off Coumadin or come in from a nursing home, or it's difficult for them to get to the dentist, and you're needing to do some sort of evaluation that day, you can now do a D0150 comprehensive oral evaluation that day. And so you can even do a D0120, a periodic exam, if it's a patient of record you've seen in 3 years. So you can do it that day. Again, not ideal. It's used in limited circumstances, but you can do that. And then you'd be getting the patient back to do continued work. So after the proper diagnosis, the patient is then going to get rolled into either doing a prophy or doing a D4346 if there's no bone loss and generalized gingivitis, or you could do D4341 or 42, the scaling and root planing. So it depends on the health of the patient. But all this is outlined on practicebooster.com. If you go and log in, it's got the flow charts. It's got the new updated entry with all the ins and outs and do's and don'ts. Make sure you follow that stuff. Check it all out. Again, I'm Dr. Greg Grobemeyer with Practice Booster. Come see us, practicebooster.com. Thanks a lot.